So Enterovirus D68 is the virus people are concerned about right now. It's a virus that's discovered in the 1960s, and enteroviruses are a type of fall and late summer virus that are common every year, and they usually cause meningitis this time of year. This particular one, though, is causing a lot of upper respiratory infection symptoms, specifically in children, young children, and in children with asthma. And that's the bulk of what we're seeing in this part of the country. We've had cases that are probably, enterovirus. It's just that you'd have to have a specific test for testing for it. And since viral respiratory illnesses, you treat them symptomatically, you're just treating it. So we've had lots of cases that present similar to RSV bronchiolitis, and we treat them just like RSV bronchiolitis outside of RSV season. They're likely enterovirus and have since August. And the two groups that are most likely to have problems with it are the very young, so those children in the several months up to a year and a half, 2 years, because they're the most prone to have problems with respiratory illnesses. And then the second group would be your children who are just with asthma, who are young. So the children who are 5, 6, 7 with asthma. Those are the ones who we see having problems with this. Even the older kids with asthma, they just are more likely to have problems with a bad asthma flare-up or bad asthma exacerbation. Could this be, polio virus? I'm not saying this is polio. I'm saying, could this be similar to viruses like polio that can do that? Could this be some strange form of something called Guillain-Barré syndrome, which is after a viral illness where people develop paralysis? It really is just speculation because they don't know yet. So scientists are testing this right now out in that area to see what it is. So at this point, it really is just watching and waiting to see what they find out. Enterovirus is here. It has been here for decades. It comes every year from the end of August all the way through the fall. This particular year, it's presenting with respiratory symptoms. Most other years, we see viral meningitis with enteroviruses. This year, we're seeing more respiratory symptoms with this. It will be here next year and the year after. Who knows if it'll present with respiratory or if it'll do meningitis next time. It's here every year. It's common sense things to prevent this from spreading. And most likely, this thing will die out like enterovirus does every year. These cases in Colorado are concerning, and let the scientists do their job. They're going to figure this out. In the meantime, clinical doctors like myself, we are trained in taking care of children who are sick. We will take care of your family.